And we know a lot of you have questions about the coronavirus. Well, today we took a doctor from UW Health out on the streets with us so that people could ask him questions, and we tested people on their knowledge of the coronavirus. Here's what happened.
Do you have questions about coronavirus?
It's interesting to see what happens when you take a doctor out of his office and put him on the streets.
I feel like it's weird for them to see a doctor outside of the hospital.
I mean, it is. There's not too many of us standing on State Street in a white coat.
We took UW Health's Chief Quality Officer, Jeffrey Pothoff, to State Street to answer random people's questions about coronavirus.
How dangerous is the coronavirus?
So when we talk about how dangerous the coronavirus is, a lot of people will compare it to influenza. So you'll hear a lot in the news that influenza is killing more people than coronavirus, and that's technically true. But if you look at the number of people who get really sick from coronavirus versus the number of people who get really sick and potentially die from flu, coronavirus has a much higher mortality rate than influenza.
If I were to think I have it,
yeah.
Is there a way to get tested now or not, or how complicated is that?
Yeah, I'd say what we recommend is if individuals think that they might have the coronavirus or just want to have questions answered about the coronavirus, UW Health has a hotline staffed by healthcare professionals who can walk you through whether you need to get tested or whether you don't.
Is it deadly for like people that aren't old or young, really?
Yeah, so you're kind of asking like who's most at risk for having like a bad outcome from coronavirus. Yeah, we know that it affects the elderly much more so than the young. In fact, it's not all that common in kids. Folks who are older, say over the age of 65, who have comorbid conditions like high blood pressure, heart disease, lung disease, diabetes, they're the ones that would be most at risk.
What should we do about traveling?
Yeah, what I suggest,
the country.
Yeah, so what I suggest people do for traveling is go to the CDC website. They have a great travel advisory that will tell you all the different warnings for the different countries and what they think your risk is, and then you can make an educated decision on whether you should travel or not.
Lots of good questions, but we also wanted to see how much everyone else knows about the coronavirus and prevention methods.
If you're worried about getting the coronavirus, if you wear a mask, does it make you more safe?
Probably not, because if you touch her...
So you guys got the right answer. So people who are not sick, wearing a mask doesn't prevent you from getting coronavirus. And some people think it actually increases your chance of getting the virus because you're more likely to touch your face with infected hands.
Yeah, that makes sense.
Do you think soap and water is as effective as hand gel or not?
No.
You think it's not as effective? What about you?
Probably.
So hand washing is as effective as the hand gel, but you need to wash your hands for 20 seconds.
Why it's not as effective. People don't do it.
It's harder.
As educational as this was for people, Pothoff got a kick out of it too.
That was just fun.
If you have questions about the coronavirus, you can call the UW Health hotline number there at the bottom of your screen. But it was really interesting to be out there to see what questions people had. And like you guys said during that story, people asked a lot of really good questions.
Very good questions. 20 seconds, you're saying that seems like a long time.
To wash your hands seems like a long time. He was really good with his answers, too. Really good.
Awesome.
He's a professional.
Yes.
There's no doubt.
Jamie, thank you.
Thanks, Jamie.